And this will give me a chance to start the machines over there for the demonstration. Thank you.
Thank you very much, thanks for inviting me to come here to Cyprus. I will spend the next 10 minutes or so to give you a very superficial or high view of the use of imaging for diagnosis and planning of interventional procedures. It is impossible to talk about this without mentioning an old technique which still is alive in many institutions, but that is the classical ascending venography. When I studied radiology in Norway from 1987 to 1990, it was a common practice to diagnose DVT with an ascending venogram. As you all recognize, this is obviously two-dimensional study. You can rotate the limb to get a better understanding of the three-dimensional view, but it's two-dimensional in principle. It requires injection of contrast into the limb. It used to be regarded as the golden standard for diagnosis of DVT and also gives some hemodynamic clues during the study. Just to give you a recent or not so recent example of a 56-year-old man with chronic with acute leg symptoms, negative ultrasound evaluation, but very suspicious for DVT. And this is the venogram, and you may all have seen this before, but this is a dying read, still applicable though for selected cases. And this is from 2005, and the last venogram I did for this indication. Now, we still use ascending venography to evaluate patients with post-thrombotic syndrome, especially when we are planning or seeing if they can be candidates for recanalization. And this, as you know, depicts common findings in these patients with chronic occlusions of the femoral veins, and as in this case, a very poor inflow into the pelvis, probably excluding this patient for a recanalization procedure. Now, to step up to CT venography, this is obviously a study that requires contrast injection for the venous evaluation. It's a challenging study in the sense that the timing of the image acquisition is critical and difficult because of the difference in cardiac output and transfer time for contrast in between the different applications. And in these times, the use of X-rays has become criticized, and that challenges this study as well, as it is, requires quite a bit of radiation. It gives 3D capabilities, and you can look at the images from different angles. So in terms of planning procedures, it is very helpful. And it also gives a very good overview over the total anatomy of the iliac veins and the inferior vena cava, if you're thinking about lower or below the diaphragm procedures. There are really two ways of doing this. You can inject the dye directly into an arm vein and wait for the venous phase. As I mentioned before, timing is difficult, but it gives very valuable information. And if you wait long enough, you can be sure that you have filled the entire venous system and you see the venous structures in general. This is just an example, a still image of the inferior vena cava and the aorta, and you can see here that this is a patient with retroperitoneal fibrosis, which has engulfed the aorta and also made the inferior vena cava just a little slit, as you can see here. And this was helpful to know before you went to a venography and potential final procedure for this patient with severe leg swelling. This is another example of a patient with May-Thurner syndrome. and I'm not sure how to do this. Nikki. How do you play that? Yeah, this is actually not going to play for us here, but what it really sees is the narrowing of the common iliac vein at the bifurcation on the left side, and is very helpful for the evaluation of May-Turner syndrome, as you know. And the venogram actually does confirm the findings on the CT scan, but the details of the iliac veins is not very well seen, even though the vein looks widely open. But you get some hints of septations in the vein, which you did not see on the CT scan. And this can obviously be evaluated in a 3D profile. Now, the other alternative for CT venography is to inject contrast directly into the affected limb. Also challenging in the terms of timing the study. And the other thing here, which can be misleading, is that now you're injecting directly into the veins in the foot, typically, or the arm, and you will get filling of the veins that directly communicate with the infusing vein, but you can get unopacified blood which fills in, and that may mimic thrombus or chronically occluded veins. So in that understanding, this is not as helpful as a general CT. This just demonstrates a patient that we had stented into the profundofemoral vein, demonstrates an open stent all the way into the profundofemoral vein. You can see the greater saphenous vein here, and no filling on the right side, as this is injected directly into the affected limb. And just to demonstrate something that you probably all have seen before, you can notice the Simon-Nightingale filter here sitting in the inferior vena cava. And here you can see the stent into the profundofemoral vein, and also the greater saphenous vein that drains through the side arm of the stent. You can also see the details of the greater saphenous vein and the patent segments of the deep venous system all the way down to the leg, as depicted in these images. So what do we know about the diagnosis of deep vein thrombosis with CT? Very little, really. Ultrasound has really replaced ascending venography, as I talked about before, and CT hasn't really caught up for many reasons. This is a study from quite a while ago, demonstrated that you can actually use CT to detect deep venous thrombosis of the lower extremity, and it does also help in that detecting DVT in areas where the ultrasound is not applicable, at least not in all cases. So let's turn to MR venography. There are patients that are excluded from the MRI, at least in general terms. It is highly dependent on the operator and has a lower resolution than CTV. It also gives 3D images. It gives a very high overview over the anatomy and the disease process. Contrast is not needed, and it can also be used to get hemodynamic data. This is just to demonstrate how complex diagnosis of venous disease can be. Those are the different protocols that can be used for depiction of the venous system. And this is a study done with a albumin-connected MR agent, and demonstrates a filling defect and acute thrombus in the femoral vein in this case. This is also a blood pool agent connected to where the molecule is connected to the albumin and sits in the bloodstream for a long time. Here you can see both the arterial and the venous system, and then with the arms elevated you can depict the compression of the subclavian veins by the musculature in the shoulder. I was hoping that this would play for us, and it may or may not, and maybe I can ask you to come up here. This is a CT scan of a patient with pelvic congestion syndrome. This is the MRI that I'm first going to show you here. It practically demonstrates, depicts the vasculature of the pelvis, and you can note the severe or the multiple collaterals in the pelvis and the perineal area here, and demonstrates how a good MRI is at depicting the vasculature or the venous vasculature in this area. And if we now look at the CT scan, you will note the varicosity is in the pelvis, the varicosity in the perineal area, but you will also note here compression of the renal vein on the left side by the supramesenteric artery. Let's just go back to that. And this is a clear, and here you can see the compression of the renal vein by the supramesenteric vein. And this is confirmed by the venography of the left renal vein. Here it is clear how the catheter venogram can help you, because you can measure pressure gradients, but you also see the reflux into the gonadal vein, which subsequently was treated. And based on the MRI practically and the ultrasound that you subsequently obtained of the perineal area, direct sclerotherapy is applied. Now I talked about hemodynamic capabilities of MRI, and this just demonstrates a patient with compression of the iliac vein on the left side with multiple small collaterals. And then when you do a flow-sensitive phased contrast MRI, you can see the arteries here in white, the common iliac arteries and the internal iliac arteries. And then you can see the internal common iliac vein or external iliac vein, but the internal iliac vein on the left side turns out to be white, and that's because the flow in that vein is now reversed because of the obstruction higher up. Intravascular ultrasound, I was asked to say a few words about that. I haven't used intravascular ultrasound much. It is obviously an invasive study, but usually it's done in association with other invasive procedures. You need one more instrument in your laboratory to be able to use that, but it gives very accurate imaging of the vascular lumen, and measurements are very accurate. This is the same study as I showed you before. You can note that there are filling defects here if you look closely, and this vein does not look healthy, and certainly not where the common iliac artery crosses it. Now this is the intravascular ultrasound. I'm not going to go through in any details here as we can play it, but you can see septation that you could actually see on the images all the way up. And then if you were able to see this video here, and you saw this from Dr. Naglund yesterday, the compression of the common iliac vein by the common iliac artery was very obvious. And this was subsequently addressed with the stents, and we were not quite happy with the upper end of the stent. Intravascular ultrasound was again performed, and that led us to place a stent further into the inferior vena cava to completely cover the area. And that's where the ultrasound came in handy. Finally, I think venography still has a place in the diagnosis of acute DVT, but very rarely. Venogram is still a very important part of the workup for chronic post-thrombotic syndrome, but MRV and CTV have really replaced it for the majority of patients. And I think that MRV has a bright future, and we are only going to see more of it used for the evaluations of patients with DVT, chronic and acute. And intravascular ultrasound has an important function in the procedural and diagnostic element. Thank you.